Okay, my name is Cleophas Chimbetete. I'm a medical doctor practicing in Harare, Zimbabwe. Newlands Clinic. We look after HIV-infected individuals living with HIV and AIDS, children, adults, and adolescents. And we've got a couple of partnerships that have really supported our work. As you will know, Zimbabwe is one of the resource-limited settings facing a huge burden of HIV disease in the country. And we've got various partners that have supported the work that we are doing. And essentially, from our experience, there are key issues that we've learned. One of the most important thing in terms of partners is when partners appreciate the role of each other, that it's more of complementing each other, not policing each other, or somebody coming in as a big brother or somebody telling the other what to do, but it's essentially respecting each other, respecting each other's priorities. Usually what tends to happen with these north-south partnerships is one of the partner has got resources, the other does not have resources. But at the end of the day, even where the resources are not there, the partner may have its needs and the partner may have its priorities. So it is important whoever is coming to partner these organizations must also respect their priorities, must also respect their needs, must also respect their aspirations and their future plans and goals, rather than just come and dictate to them what they are supposed to do. I think once there is that appreciation, it becomes easy to work with each other. And there must be transparency between the partners, especially when it comes to financial resources. When financial resources are used, it must be clear and it must be very transparent what these resources have been used for. And people must have access to financial accounts, must have access to the books, just to make sure that whatever has been agreed upon has been done. Otherwise, you don't want a situation where people bringing in money to look after people living with HIV, and some partners then take the money and use it for other things. So I think the issue of transparency is very essential. I think the other, just thinking of what are some of the key lessons learned, what is also clear in this partnership is that we have got a lot to teach each other. It's not just the rich partner teaching the so-called poor partner, but I mean, we learn from each other. So that mutual respect is important, and that willingness to learn from each other is also very important, because as we share experiences, we become better in our individual capacities, and we become better even for the future partnerships that we are going to get involved in. And also, as partners come into a country, they need also to respect the government of the country, to respect the national policies of that country. You don't want to bring in new policies. You don't want to come in and start implementing things outside national guidelines, outside national priorities. For example, in our country, when it comes to HIV and AIDS, as a nation, we've got national priorities. As a nation, we've got national goals. As a nation, we have got national strategic frameworks. So whoever is coming to partner must be willing to work and to operate within the national goals, within the national frameworks, within the national, and also respect the national guidelines, respect the relevant national institutions, be it national ministries of health, be it ethical bodies. I mean, partners must also be able to respect that.